name is Allison Hessel. I'm a global product manager for topical skin adhesives, and today we're going to be talking about LiquidBand XL. LiquidBand XL is a sterile skin closure system designed for use on long or high tension incisions. It is intended for use on topical applications only to hold closed easily approximated skin edges from surgical incisions. We currently have two products available, LiquidBand XL 22 cm and LiquidBand XL 44 cm. And a third product, LiquidBand XL 66 cm, is currently in development at the time of this recording. This presentation will focus primarily on the LiquidBand XL 22 cm product. Each carton of LiquidBand XL contains two systems. Each sterile pouch in the 22 cm product contains one large 2.7 gram applicator filled with an octyl cyanoacrylate adhesive and one 22 cm by 4 cm polyester pressure-sensitive adhesive mesh strip. The 44 cm product contains two of these applicators and two 22 cm by 4 cm mesh strips. It is important that we all use the same terminology when discussing LiquidBand XL, as there are many components that make up a single system. Let's take a look at these components, starting with the adhesive applicator. Number 1 is the foam tip. At the bottom of this foam tip is number 2, the applicator foam tip cap. Beneath these two components is number 3, the applicator tip base, which contains number 4, the sintered block inside of it. Number 5 is the inner glass ampule filled with the 2-octyl cyanoacrylate adhesive. This ampule sits inside of number 6, the applicator wing body. Finally, outside of the applicator, we have number 7, the mesh strip. There are also a few individual components that make up the mesh strip. Number 1 is the mesh itself. Number 2 is the white release backing paper, which is composed of two separate triangle-shaped pieces. Number 3 is the release tab, which helps to remove number 4, the clear release liner that sits on top of the mesh. Our mesh strip was designed to be intuitive and easy for healthcare providers to use. It is made of a woven polyester material that is coated with a pressure-sensitive adhesive to help it stick to the patient's skin and hold incisions closed prior to liquid adhesive application. The release backing paper is configured to be removed in two parts, leaving the mesh attached to the clear release liner. This clear release liner is designed to allow physicians to see the incision through the mesh, letting them easily position the mesh over the incision without needing to place it down and reposition the mesh. The white release tab on the clear release liner is easy to see and provides quick removal of the clear release liner once the mesh has been applied. It's important to note that LiquidBand XL, like the leading market competitor Dermabond Prineo, is an accelerated technology. This means that the liquid adhesive mixes with a chemical during application that allows it to dry. Unlike Dermabond Prineo, however, our accelerant is not contained in the mesh strip itself, but in the adhesive applicator. We'll talk a little bit more about this in the coming slides. Finally, as previously mentioned, each of our mesh strips are 22 centimeters long by 4 centimeters wide. Now let's look at the adhesive applicator again. This applicator is much larger than our other LiquidBand topical skin adhesives, and each one contains 2.7 grams of liquid adhesive. As I mentioned on the last slide, LiquidBand XL is an accelerated technology, which means it mixes with a chemical that allows it to dry. This accelerant is located within the applicator tip, inside of the sintered block. When the applicator is primed and the inner glass ampule is broken, the glue will flow through the sintered block, mixing with the accelerant and starting the chemical reaction that dries the glue. As a result, if glue is not continuously flowing through the applicator tip, the tip will become clogged with dried glue, slowing or stopping the expression of glue onto the skin. Like the mesh strip, the LiquidBand XL applicator was also designed to be easy and intuitive to use. The applicator body contains our signature LiquidBand wings, which allow for easy one-handed priming. The broad tip of the applicator provides wide, controlled glue application, and the porous foam material controls the flow of the glue and helps to prevent excessive squirts or dripping during priming or application. One important benefit of LiquidBand XL is that it provides a microbial barrier to incisions. Our testing has proven that LiquidBand XL is effective against 8 organisms commonly responsible for surgical site infections for at least 7 days. These microbes included both gram-positive and gram-negative bacteria, as well as fungal microbes. LiquidBand XL's microbial barrier is effective as long as the adhesive film remains intact on the patient. LiquidBand XL provides many features and benefits designed to meet the needs of both patients and healthcare providers. The octyl-based cyanoacrylate adhesive formulation provides strong and durable wound closure for up to 14 days after application. The accelerant in LiquidBand XL provides consistent dry times in as little as 60 seconds, and, as I just discussed, LiquidBand XL provides an effective microbial barrier to incisions. Our signature winged applicator is safe and efficient to prime, and the wide foam tip allows for controlled adhesive application. The mesh is user-friendly and easy to apply, with an easily removable clear release liner for proper wound visualization. Up next, we'll watch a quick video showing how to apply LiquidBand XL.
This presentation is intended to provide a guide of how to apply LiquidBand XL skin closure system. This is not intended as a training tool and is not a substitute for referring to the instructions for use. A carton of LiquidBand XL consists of 2 systems. Each system contains a self-adhering mesh and a liquid adhesive applicator. The LiquidBand XL skin closure system requires thorough wound cleansing prior to application. The skin edges must be closely approximated and patted dry to ensure adherence to the skin. Remove both sections of the white release liner from the back of the mesh. Hold the mesh by the clear release liner and ensure the adhesive side of the mesh is facing the skin. Place one half of the mesh to the skin, ensuring the mesh is placed at least 1 centimeter from each of the ends of the incision. Gently press over the initial half of the mesh to ensure that it has adhered to the skin. By holding the clear release liner, pull the mesh over the incision. Adjust with fingers to achieve skin edge approximation. Then affix the remainder of the mesh to the other side of the incision by pressing down gently. Pat the clear release liner down so that the mesh has fully adhered to the skin. Pull the white tab and tear off the clear release liner. Remove the liner in a circular fashion. Hold the applicator with the tip facing upwards. Squeeze the applicator wings to apply sufficient pressure to crack the inner glass ampule. There will be an audible and tactile feel when the ampule is crushed. Invert the applicator. Firmly squeeze the wings and immediately apply the adhesive. Using the broad tip on the applicator, apply even coverage over entire length of the mesh and the surrounding skin with long, even strokes. Once coverage is achieved, wait 60 seconds to allow the adhesive to polymerize. After 60 seconds, lightly touch the surface with a clean gloved finger to ensure the adhesive is fully polymerized. LiquidBand XL skin closure system is an ideal alternative to sutures or staples. No secondary dressings or bandages are required. LiquidBand XL provides security for daily activities and a water-resistant microbial barrier. Safe, secure, effective. Start your patient's recovery with LiquidBand XL.
Now that you've seen how to apply LiquidBand XL, we'll walk through the steps in a little bit more detail. As with any topical skin adhesive, the incision must be clean and dry. Hemostasis should be achieved, and any remaining fluids should be removed from the skin surface with sterile gauze. Remove both sections of the white backing paper from the mesh, and hold the mesh by the clear release liner. Make sure to refrain from touching the mesh itself to avoid the mesh sticking to your hands. Hold the mesh above the incision and position the mesh so that the incision is centered. Ensure at least 1 centimeter of mesh extends from each side of the incision. When applying LiquidBand XL to an incision longer than 20 centimeters, position the mesh so that it extends at least 1 centimeter from one end of the incision. Press half of the mesh down onto the skin along one side of the incision, and, using the clear release liner, pull the mesh across the incision, approximating the skin edges prior to pressing the remaining half of the mesh down onto the skin along the opposite side of the incision. You can do this either by pulling the mesh towards you or away from you, based on your personal preference. Press one finger onto the upper edge of the clear release liner to hold it in place, then use the release tab to tear the clear liner, removing it from the mesh's surface in a circular motion. When applying LiquidBand XL to an incision longer than 20 centimeters, apply the second piece of mesh following these same instructions. Ensure that the second mesh strip overlaps the first by at least 1 centimeter, and that the end of the mesh extends beyond the edge of the incision by at least 1 centimeter. Excess mesh may be trimmed away and discarded. Because LiquidBand XL is accelerated and can dry in the tip if glue is not continuously flowing, it is very important to not prime the adhesive applicator until you are ready to apply the glue. When ready, hold the applicator with the tip facing upwards. This ensures that the glue does not prematurely come into contact with the accelerant in the tip, and allows any glass shards from the ampule to fall to the bottom of the applicator to avoid blocking the flow of glue. Firmly squeeze the wings, either using your fingertips as shown in the image on the screen, or by using a closed fist around the applicator body until the inner ampule is fully crushed. You will both feel and hear the ampule break in the applicator. When it is time to apply the glue, turn the applicator so the tip is pointed down and firmly pump the wings until the foam tip turns purple. Once the tip is purple, the device should be used immediately, and glue should continuously flow through the tip. You are in control of how quickly the glue is expressed. You may choose to continuously squeeze the wings for a consistent, faster flow, or use a pumping motion for a more precise and controlled flow of glue. This slide shows a visual representation of the same application steps we just walked through. These images are available in the instructions for use and in a standalone application guide that can be provided to healthcare providers as a reminder of the steps to apply LiquidBand XL. LiquidBand XL is durable enough to stay on the skin for up to 14 days after application and will gradually slough off of skin naturally. However, if the healthcare provider indicates it is safe or necessary to do so, LiquidBand XL can also be manually removed. These instructions are available in the IFU if needed. Gently grasp the edge of the mesh patch at one end of the incision. If the edge of the mesh is still adhered to the skin, gently pick at the edge until it begins to peel away. Slowly peel the mesh away from the skin along the line of the incision, being careful not to pull the mesh straight up from the skin as this can cause the wound to dehisce. One hand should pull the mesh back along the line of the incision close to the skin, while the other hand is used to stabilize the incision as the mesh is peeled away. Once the entire mesh has been removed, it can be discarded in an appropriate medical waste container. Any residual adhesive or dried wound exudate can be cleaned from the skin according to institutional standards of care for skin cleansing. Now let's look at some tips for in-servicing LiquidBand XL, starting with the mesh. Before beginning, it's very important to understand which products surgeons are currently using to see if they will need extra help with mesh application. Surgeons who don't use a mesh and glue system, or surgeons who have only ever used Dermabond Prineo 60, which comes in a tape reel rather than a mesh strip, may have some difficulty getting the edges of their mesh to lay flat, or may need some additional help learning how to apply the mesh properly. It's important to take the time to explain proper techniques for mesh application. Surgeons will need to be precise with where they apply the mesh, as after the pressure-sensitive adhesive coating has been activated, repositioning the mesh can be difficult. Remind users that the clear release liner was designed so that they can touch anywhere on the mesh, applying pressure where the mesh should adhere to the skin, and that they can use the clear release liner to pull the mesh across the incision and help approximate skin edges. Finally, always use caution when removing the white backing paper. This will help avoid crinkling or accidental detachment of the mesh from the clear release liner. When in-servicing the glue, it's critical to understand who primes the current device for the surgeon. When using LiquidBand XL, the preference is always for surgeons to prime their own applicator, as this can help to prevent premature clogging. Once again, remind everyone involved in the incision closure to not squeeze the wings or prime the applicator until they are ready to use the glue. When speaking with anyone assisting with closure, ensure that they know to hold the applicator with the tip facing up until ready to use if they are priming the applicator for someone else. When applying the glue, users may use a pumping motion to control the flow of glue being expressed from the device. This allows for a more precise application. Alternatively, if the user prefers, they may continually squeeze the wings for a faster flow of glue onto the skin. It's important that surgeons only apply a single layer of glue over the mesh. This will help ensure even, consistent coverage and reduce the risk of glue becoming too thick or congealed in any one area. Now let's look at the primary competition for LiquidBand XL. The current market leader, Dermabond Prineo, offers 3 sizes: a 22 cm mesh strip, a 42 cm mesh strip, and a 60 cm tape reel that features a narrower mesh in a unique design. The picture on the top right corner of the screen shows the Dermabond applicator and mesh strip design. Unlike LiquidBand XL, Dermabond Prineo features a pen-style applicator similar to other Dermabond products. Ethicon positions Dermabond Prineo based on strength, protection, and patient satisfaction. The product supports skin closure with strength equivalent to a 3-0 monocryl suture in ex vivo testing. In vivo testing shows that Prineo provides a flexible microbial barrier with 99% protection for 72 hours against organisms commonly responsible for surgical site infections. Finally, Ethicon claims that Prineo leads to greater overall satisfaction for surgeons and patients when compared to skin staples. Like LiquidBand XL, Dermabond Prineo is an accelerated adhesive. However, Dermabond Prineo's accelerant is contained within the mesh. During application, the user must manually mix the adhesive with the mesh strip using many short strokes of the applicator across the mesh's surface to allow the glue to dry. This means that Prineo's applicator will not clog during application, but the glue will not dry unless it comes into contact with the mesh. Any excess glue applied to the surrounding area of patient skin or glue that runs off of the mesh must be cleaned up after application. The advantage LiquidBand XL presents over Dermabond Prineo is that the accelerant is within the tip of XL's applicator. This allows our glue to be used on a greater portion of the patient's skin, without the fear of glue running, requiring additional cleanup. The other product commercially available is Commence's Exafin Fusion. Fusion is also available in 3 sizes, 22 centimeters, 30 centimeters, and 60 centimeters. All 3 sizes are available in mesh strips, and each come with multiple tubes of liquid adhesive. The applicator for Exafin Fusion is displayed on the screen and resembles a tube of toothpaste or superglue. The applicator does not come pre-assembled and requires the user to screw in the tip prior to use. Commence positions Exafin Fusion in the market as being fast, easy, sterile, and strong. The adhesive is said to be tack-free in under 45 seconds, with full polymerization occurring within 60 seconds. The application process is easy, with users needing only to open the mesh strip, place it, and seal it with adhesive. Independent third-party testing has shown that Fusion eliminates bacteria growth, and the adhesive creates a watertight microbial barrier, allowing patients to quickly resume normal activities like showering. Finally, Fusion creates a strong seal with great holding power, as the curved shape of the mesh evenly distributes tension along the entire incision, preventing skin gaps from forming. The key difference between LiquidBand XL and Exafin Fusion is in the applicator. Fusion requires the user to initiate a 5-step process to install and activate the applicator tip, which involves assembling the applicator, releasing air from the glue tube, and squeezing and wasting 3 drops of glue during the priming process prior to beginning to use the product. As I mentioned on the last slide, Exafin Fusion provides multiple applicators in each system, including 2 applicators in the 22 centimeter product and the 30 centimeter product, and 3 applicators in the 60 centimeter product, in case the adhesive coverage with a singular tube is not sufficient to cover the entire mesh. If a user needs to open the extra applicator, they will be required to restart that same 5-step activation process a second time. LiquidBand XL's advantage over Exafin Fusion is that the applicator design enables simple one-handed priming. Immediately after crushing the ampule, the XL applicator can be inverted and used, and each applicator contains sufficient adhesive to cover a full 22 centimeter mesh strip. Each of the 3 products on the market contain the same components, although the actual chemistries used and the ratios of each will differ. All 3 products contain a blend of octyl cyanoacrylate and a plasticizer, which helps to keep the glue malleable. LiquidBand XL and Dermabond Prineo contain similar levels of this plasticizer, while Exafin Fusion contains slightly less. The liquid adhesive component of all 3 products does not contain PMMA or thickeners, and each one has a viscosity that is very similar to that of water. This allows the glue to pass through the mesh and better adhere to the skin. All 3 products are also accelerated, and while they use different chemical accelerants, each of the 3 liquid adhesive formulations must mix with the accelerant in order to dry. The primary difference in the products there is in where the accelerant is located. The sintered block in XL's applicator acts as a static mixer, as the glue must flow through it to exit the applicator, which provides a very consistent delivery of accelerant to the glue. Prineo's accelerant is contained within the mesh, which means that the mixing process is manual and less thorough than LiquidBand XL, as the user mixes the accelerant into the glue by painting the glue onto the mesh. This can result in less consistent adhesive delivery. Fusion utilizes the accelerant in a porous disc in the adhesive applicator. This allows the initial expression of adhesive to dry quickly, but can result in tackier glue and inconsistent dry times by the end of application. Finally, all three products do contain similar stabilizer blends. The biggest differentiator between LiquidBand XL and the other two products on the market is in the applicator. The winged applicator was designed specifically to make priming quick and easy, and the tip of the applicator is wider than the other two products, providing fast, simple glue expression. The foam tip of the applicator also differs from Prineo and Fusion, both of which use a silicone tip. The foam catches the glue as it is expressed through the applicator, reducing the risk of excessive dripping or squirting during priming and application, and allows the user to better control where the adhesive is placed. The mesh component is relatively similar between all three products, as the materials and patterns are equivalent, and all three strips contain similar levels of pressure-sensitive adhesive coating. The primary difference between the mesh designs is that Prineo's accelerant is contained within the mesh, which is a patent-protected technology owned by Ethicon. Our applicator is designed to be easy to use and save time during incision closure by providing simple one-handed priming process and less chance of drips or squirting adhesive that would then need to be cleaned up. Surgeons can also easily correct over-application pools using the broad strokes of the applicator tip as opposed to the many short strokes required by other products. Finally, another key differentiator is in our microbial barrier. LiquidBand XL provides a water-resistant barrier over incisions, which sets it apart from other skin closure methods such as sutures or staples. Our testing proved that XL maintains a barrier against gram-positive and gram-negative bacteria and fungal microbes at both day 3 and day 7, as long as the adhesive film remains intact. These next few slides discuss how to sell LiquidBand XL against the competition. The primary advantages of XL over Prineo include the applicator design, which is ergonomic and easy to use. Remember that the accelerant is in the tip of the applicator, not on the mesh, so the glue can be painted onto a greater portion of patient's skin without requiring cleanup. XL consistently dries in as little as 60 seconds, and the wide foam tip provides precise coverage and control over adhesive placement. Keep in mind that Dermabond Prineo's 60 cm size is contained within a tape reel, not a mesh strip, as pictured in the lower right side of the screen. This tape reel functions similarly to packaging tape and can result in issues such as the mesh tangling or sticking to itself during application. Additionally, the mesh in this tape reel is only 2 centimeters wide, which does not leave a wide margin for error when placing the mesh, and can also be difficult to navigate when closing curved incisions. When selling against XFN Fusion, XL provides similar advantages. Again, the applicator is ergonomic and easy to use, and the consistency of our glue dry time is key. Each XL applicator contains sufficient adhesive to cover a full 22 centimeter mesh strip. Remember the main differences between the two applicator designs, as XFN Fusion's applicator is a foil tube, similar to that of toothpaste or superglue. It is difficult to express all of the glue out of this applicator, and it does not provide the surgeon with any visibility as to how much glue remains in the applicator during closure. Another competitor we have not yet discussed is anchor systems, such as Zipline. Zipline is composed of 2 strips applied on either side of an incision and pull tabs that are then pulled to close the incision and keep it closed. The incision remains exposed underneath the tabs as there is no mesh component or liquid adhesive to protect it or provide a microbial barrier. Additionally, anchor system application is a tedious multi-step process, as you can see in the picture on the right side of the screen. When selling against these products, it's important to highlight XL's one-step process of approximating the skin edges by simply pulling the mesh across the incision. LiquidBand XL can be used in any of the procedures listed on the screen. Our focus markets are in orthopedic procedures, such as hip or knee replacements, plastic procedures, such as abdominoplasties or paniculectomies, a wide variety of general surgery procedures, and OB/GYN procedures, including C-sections and total abdominal hysterectomies. Remember that LiquidBand XL 22 cm can be used to close incisions of up to 20 cm in length, and LiquidBand XL 44 cm can be used to close incisions of up to 40 cm in length. The instructions for use provide additional dosing and usage guidelines for surgeons. To wrap up this training module, we'll look at the 4 targeting segments we have for LiquidBand XL products. Our top priority customers are those who are currently using Dermabond Prineo or XFN Fusion, as they are the most familiar with mesh and glue systems and already believe in the technology. These customers will be easier to convert to LiquidBand XL as they already know what mesh and glue systems can do, and the user-friendly design of LiquidBand XL will be an advantage. To set yourself up for success, Make sure the first few facilities you enter when selling LiquidBand XL are not die-hard J&J or Ethicon strongholds, as these facilities will be less likely to convert to our products. Second, we want to target the former Preneo users. These surgeons already believe in the technology but may have had challenging outcomes previously that have changed their opinions on the product. They may be interested in an alternative, which you can use to your advantage when selling in these facilities. Keep in mind that sometimes the decision to stop using Preneo may have come from a decision maker and not the surgeon themselves if the facility is experiencing budget constraints. Third, look at lost accounts. Who did we sell to previously who has stopped purchasing from us because we did not offer a mesh and glue system? We are now more competitive with a full range of products and can leverage previous relationships we may have to win these facilities back from competitors. Be aware of the time frame it takes to introduce XL to any of these accounts, as the selling process for LiquidBand XL can be quite lengthy. The final targeting segment is new accounts who don't have a current relationship with AMS. LiquidBand XL gives us the opportunity to build new relationships as we have a complete portfolio to offer these accounts. These targets allow us to build our market share and provide innovative technology to facilities who may not have experience with them yet. When looking at these accounts, it is important to seek out how XL can solve their current problems, leveraging selling features such as the microbial barrier against problems like higher SSI rates. Keep in mind that these facilities may be new to topical skin adhesives altogether, in addition to mesh and glue systems, and may require more education about the features and benefits compared to other skin closure methods. This concludes our training module on LiquidBand XL. For any additional questions over this material, please reach out to your regional marketing representative.